Hyperventilation. Hyperventilation occurs when the rate and quantity of alveolar ventilation of carbon dioxide exceeds body's production of carbon dioxide. Hyperventilation can be voluntary or involuntary. Causes. There are many factors that can lead to hyperventilation. Most commonly, the condition results from anxiety, panic, nervousness, or stress. It often takes the form of a panic attack.
Hyperventilation literally means over-breathing. When hyperventilating, a person breathes much faster and deeper than normal. Usually the respiratory rate is higher than 20 breaths a minute. Acute hyperventilation can be very frightening. You feel like you are not getting enough air. Because of the rapid, deep breathing, you inhale a lot of oxygen, while at the same time the carbon dioxide level in the blood decreases. The chemical changes in the blood causes complaints. The symptoms differ per person. Common symptoms are dizziness, fainting, nausea, and chest or abdominal pain. Tingling around the mouth and in the hands is also very common. Panic during an attack can make the breathing go even more out of control. Hyperventilation manifests itself in attacks and is often caused by tension. It can also occur on high altitudes, be triggered by strenuous work, panic, physical injuries, or poisoning. Sometimes hyperventilation develops into a chronic syndrome. The body is under a constant pressure, for example because of too much stress and sleep deprivation. In order to stop an attack of hyperventilation, it is important to calmly breathe in and out. Start with a deep breath out, followed by a deep breath in. Breathing in and out in a paper bag may help. A long-term solution to chronic hyperventilation is breathing therapy. Hyperventilation is not dangerous, but if the attacks are bothering you a lot, it might be wise to see a physician.
Prevention. To prevent hyperventilation, it is helpful to learn breathing and relaxing techniques such as meditation, alternate nostril breathing, deep belly breathing, and full body breathing. Mind, body exercise such as Tai Chi, yoga, or Qigong, exercise regularly, walking, running, bicycling, etc. can also help to prevent hyperventilation. When to seek treatment for hyperventilation? Hyperventilation can be a serious issue. You should seek treatment for hyperventilation when the following symptoms occur: rapid, deep breathing for the first time, hyperventilation that gets worse even after trying home care options, pain, fever, and also bleeding. Treatment. To help treat acute hyperventilation, you can breathe through pursed lips, breathe into a paper bag or cupped hands, attempt to breathe into your belly rather than your chest, cover your mouth, and try alternative nostril breathing.
You start to breathe rapidly from your mouth and start to feel dizzy or as though you don't have enough oxygen. The reality is that the opposite is true. You have too much oxygen, and by breathing so quickly, you do not give your body enough time to extract the oxygen that you are breathing in. You see, in order to extract the oxygen from the air we breathe, we need a certain amount of carbon dioxide. Hyperventilation prevents proper CO2 retention. So how do you stop hyperventilation quickly? The answer is very simple, yet very effective. When you feel that you're hyperventilating, take a breath and hold it for as long as you comfortably can, somewhere between 10 and 15 seconds. Repeat a few times until your breathing returns to normal. This will prevent the dissipation of CO2 and allow you to effectively use the oxygen you're breathing in, getting rid of that terrible feeling that you can't get enough air. I hope you found this video helpful. Please fill out the contact information in order to get more helpful information about anxiety and panic attacks. Thank you and have a great day.
started running, her muscles were working. They needed more oxygen and produced more waste gas. So the oxygen supply from the lungs must be involved. She breathes more rapidly and more deeply. In the air sacs in the lungs, the rate of gas exchange increases. More blood, more oxygen, more carbon dioxide. More work for the lungs. But also more blood needed to carry oxygen to the muscles. The heart has to work harder. It beats more quickly. The heart rate increases. It's also pumping more with each beat. The output is 4 times greater than at the start.
Thank you.